Wonderful. So I want to start by thanking the team, including Dario and Brenda and Andres, Roberto, Camila, everybody that was a part of this. That's the entire HHF team, but specifically this group pulled this together very quickly. Being able to do this virtually is very important at a time that social distancing is the mandate. It's important that none of us feel isolated and alone, despite the circumstances that we're under. It's really important that these Charla speakers that were very thrilled that stepped up because that's how Charlas work. It's listening to our community stepping forward and volunteering their perspectives on various issues. At this time, we're dealing with a crisis that is affecting so many of us in so many different ways. It's beyond the virus. It includes our mental health, includes our education, it includes our children, it includes the elderly and caring for them, workforce insecurities, housing issues, and so many others. If you're a small business, if you're a nonprofit, there are real issues that we're all grappling with. And again, a lot of us feel isolated and alone. This is an opportunity for us to come together. I want to start by thanking all of the speakers that are here. I'm gonna run through them very quickly, and I know Dario's gonna take it from here, but Dr. Blackwood, Lázaro, Nancy, Veronica, Elvis, Juliana, Robert Roman, Susana, Carlos, Jesus, Allison, Alex, Nury. Really appreciate this because it's critical that we're listening to our communities and across all communities and make sure during this time that we're all together in this. So with that, I will turn it over to Dinah Simpson, who's my wife, but has been doing a lot of work in terms of energy healing and has been working very closely with a lot of our underrepresented communities, including DACA recipients from Africa and from Latin America and Asia and other places, to make sure that their stress levels are being managed during this time. So she will lead us in a very short meditation, and then we'll kick it over to Dario to take it from there. Let me hand this over to Dinah, and she will take it from here.
Hi. Let me move this over so that I can prop it up over here. Okay. So I think I'm just gonna go through a short meditation for everybody. It's a tool that you can use to calm your nervous system down. If you've not meditated before, if you have, even if you have a regular practice, just want to encourage people to understand that meditation okay, they're saying I need to move my phone. Sorry, guys. Okay, is this better? Can you hear better? Okay.
Yeah, that's perfect.
Sorry about that. So the power behind having your mind and your body at the same place at the same time is it allows you to be in the present moment. And when you're in the present moment, your mind is not going ahead and it's not thinking about the past. And things happen when we think too far ahead. We create anxiety for ourselves. We don't know what's going to happen. We don't know what to expect, and we create scenarios in our head. So coming back to the present moment allows us just to be right here, right now. And you know, the mind and the body likes to move. It likes to chatter. It's what it does. But when we offer ourselves time for meditation, it just allows us to slow down and be in the moment. So when we breathe in and we breathe out, we start to connect within. And the benefits of this is that you allow this is where you find the benefit of meditation. Your mind and your body begin to relax, and you calm the parasympathetic nervous system, and you disconnect from that fight or flight response. So it all just kind of starts with taking a breath in and a breath out. So let's try it. We'll just do a few minutes, a minute or two. So you can, if you're sitting down, just really allow yourself to settle in. Feel your legs against your chair. And then take a deep breath in. Hold it for just a few seconds. And then take a deep breath out. We'll do that one more time. A breath in. Hold it for a few. 1, 2, 3. And then breathe out. And if you haven't done so already, go ahead and close your eyes. Find that breath, the steady breath. And we'll do a body scan, just so that we can ground ourselves at this time. So just notice the area between your temples. If you have any tension, breathe into that space and then let it go. Notice if you have any tension between your brows, and just soften that space. Start to feel the area around your neck and your shoulders. Maybe even raise your shoulders a little bit and then drop them back. And just feel a release. Notice your spine. And just trace it, your spine from between your shoulder blades down to your pelvis. And feel your arms and your hands heavy against your side or resting in your lap. And then come back to your breath. Notice as you breathe in and you breathe out, you have a little bit more space to relax. We hold a lot of tension in our bellies. Just breathe into that space and notice if there's any tightness. And breathe out. Take a breath in and a breath out, and notice your heart space. Just notice if there's anything there that wants to radiate out. If there's any fear, just use your breath to let it go. And then feel your hips and your seat. Imagine them rooted into the ground, feeling heavy and grounded. And your legs, feel them anchoring into your feet and into the earth. And just allow the earth to support you at this time. Feel heavy, feel grounded. And notice your breath. This is your anchor. Just allow yourself to surrender into this present moment. Bring awareness to the sensations in your body. And allow yourself to release the tension. And with this next breath in, breathe in love. And breathe out what no longer serves you. And let's breathe in again, breathe in peace. And breathe out gratitude. Breathe in health. And let's breathe out this moment together. And your next breath in, start to feel your hands, your fingers, and your toes. You can flutter your eyes open. And hopefully you feel a little bit more rejuvenated. I'm going to turn it back over to Tony. It's so nice to be here with you all. He's telling me if you guys want to know more about meditation, visit me on Instagram. It's at Dinah at High Key Living, DINAH, High, HIGH, Key, KI, Living. It's so nice to be here with you.
Thank you, Dinah. With that, I will turn it over to my colleague, Dario Collado, who is going to take it from here. I also want to mention that we will be doing a series of these virtual charlas over the next few months and ongoing throughout the year. But I think next week we're looking at potentially doing something on the mindfulness wellness space as we're dealing with all of these. So thank you, Dinah, for that. That was absolutely helpful and a great way to start this. So Dario, take it from here.
Thank you. Can everyone hear me? Okay. Thank you so much, Tony. Really appreciate it. Thank you, Dinah, for that amazing opportunity for us to self-reflect and really take that opportunity to hold on one second. For us to really just really breathe in and breathe out. That being said, centering ourselves for sure. With that being said, welcome everyone to today's Charla, where we will discuss coronavirus, its effects, how it's affecting us as a community, as all communities, and more importantly, to provide the safe space. Our Charla, LOFT Charla series provides safe space for everyone to discuss issues that are of utmost importance, that are in your minds, that we are thinking about. Again, this is a very safe space. I just want to go and let everyone know just a little bit about how this is going to work. My friend, Dr. Christopher Blackwood, who's with the National Institutes of Health, will speak in a little bit, talk a little bit about the history of coronavirus, what we should expect, how we protect ourselves, how we protect those in our community, especially in the Latino African American community where we have many individuals that are older. Chris will talk a little bit about that. And then also, once Chris concludes his 5-minute presentation, which will include some slides that you'll be able to see here through this webinar, we will be doing 12 sets of 4-minute each charlas. So every participant will have the opportunity to talk a little bit about how coronavirus, about yourselves, how it's affecting you and your family, more importantly. And many of you have opportunities, have information that you would like to share. We would like to take this opportunity as really as a community forum to share best practices, for example. And with that being said, we will then have some time at the end for questions. For those of you that have questions during a presentation or when someone is speaking, please feel free to use the Zoom webinar chat. which you have in front of you, in front of your computer, or if you're joining us via iPhone, you'll be able to send your question through the chat. The only thing that I would ask is when you send a question, say, this is a question for Dr. Blackwood, ask your question and then make sure that you have your name at the bottom so that we can recognize you and your question, and that we are able to ask the individuals that, so we're able to ask that individual, to be able to answer correctly your question. Again, we will have time at the end for a Q&A period. So if anyone has anything that they would like to discuss during, again, feel free to use the Zoom webinar where you could use it for all panelists, or you can send direct messages as well to myself, Antonio, Chris, or anyone else on this charla. With that said, I would like to introduce Dr. Christopher Blackwood, who's a neuroscientist at the National Institutes of Health and a professor at American University. He's also the founder of a nonprofit research foundation that helps people suffering from opioid use disorders. Dr. Blackwood's research primarily focuses on identifying biochemical and molecular substrates involved in psychiatric disorders and neurodegenerative diseases. He has published over 8 scientific articles and has received many prestigious awards, research awards. With that said, take it away, Dr. Blackwood.
Greetings, everyone. First, I'd like to thank the Hispanic Heritage Foundation for the opportunity to present at today's forum. Due to the time crunch of this presentation, this will be more of a brief overview of the scientific evidence and data in order to properly shape the subsequent conversations from today's panelists. I'd like to provide a full disclosure that I am a research scientist at the NIH, and I'm also a professor at American University, and I am not here today to represent those entities. I'm here as a member of the community with scientific background in order to help frame today's discussion. So with that being said, let's go to slide number 2. Next slide. Okay, great. So today's talk, I'm going to provide an overview of how we got to where we're at now, the pandemic. I'm going to talk about some of the intermediate plans to stop the pandemic. And I'm going to end with some useful information about symptoms, vulnerability, and best practices. Next slide. So many of you already know that the coronavirus is believed to come from Wuhan, China. As you can see on the left-hand side, it's in green. The first case was notified to the World Health Organization in December 2019. And because of the mismanagement, 4 months later, you see something that looks like what you see on the right-hand side, where the increased blue indicates the number of new positive cases. And this number is continuing to grow to this day. Next slide. And so what we really need to remember, I just want to highlight a few things, that coronavirus, as you see on the left-hand side, can exist on many different objects, from money to your wallet, to forks and spoons, to everyday toys. And a lot of these coronaviruses are put there by infected people. And then on the right-hand side, what happens is that the way it spreads is that you can infect yourself through, most likely, the eyes, nose, and mouth. And this is the reason why you see many people with masks, is to prevent themselves from being infected. And also people that's walking around with gloves is to prevent them from touching infected areas. Next slide. And so some of the best practices in staying safe is that you want to practice good hygiene. And wherever you at right now, I'm pretty sure you had disinfected your surface, the doorknob, the table, the desk, the handrail, things of that nature. You want to be doing that even in your comfortable surroundings, just making sure that the area is clean. We all know about washing our hands for 20 seconds and things of that nature. We also need to avoid crowded places. And we also need to avoid public transportation for a while. And this includes ride shares like Uber, because of the ventilation systems in cars are not really equipped to deal with this sort of virus. Next slide. And so this is probably the most important slide that I'm going to show. So the orange or the yellow represents the number of increase in newly infected people. These are positive that we have tested, and at least an increased rate of infection. And as you can see at the bottom, where we are now is where we at right now. Right above that, you see that dashed line. That represents the threshold of our healthcare system. And so what we want to do is that we want to prevent us from getting to the point where we overwhelm our healthcare system. This is usually due to the fact that people who are positive coronavirus need ventilation systems that we don't have enough of if there's a rush in the hospital. Also, protective gear, beds, things of that nature. And then at some point, we're going to be picking and choosing who lives and dies. We call that primary and secondary death. So we want to prevent that by following the purple bell curve. And this is the point where we slow down the rate of infection. And the way we do that is by self-quarantine, increase the number of testing so we can identify who has the virus, who doesn't, and another way we can decrease the bell-shaped curve is to come up with an effective vaccination, which I think will occur later down many days from now. Next slide. Here, I just want to point out some of the symptoms. On your left-hand side at the top, you can see that the increased percentage of people who test positive for coronavirus that are very, very sick, 88% of them have high fevers, dry cough, fatigue, things of that nature. But what I really want to highlight is the fact that you don't see runny nose on this list. And the reason why I want to point this out is because that we're about to enter into allergy season, flu season, and so some of the symptoms that you might be seeing might not be related to coronavirus. And so you want to have some precautions and have some good understanding before you receive medical attention at a hospital, because you might just be suffering from the common flu. At the bottom represents that our older age folks are at higher risk, those above 50. But what I really want to highlight is the misconception that healthy individuals do not die from coronavirus. The rate is low, but it's still possible. Next slide. I just want to end by talking about some of the underlying health conditions that we must be careful about. So these people are more vulnerable from dying from coronavirus. These are people with underlying conditions such as cardiovascular diseases, diabetes, any sort of immune deficiency disorder. So these are people that are a higher rate, and we need to take care of these people. We need to check in with these people. We want to make sure to limit their movement around and prevent them from being infected with the virus. Last slide. And I just want to end by saying thank you. I appreciate it. And here are some links to provide some more information. Also, the information that I got from these slides can also be found here. Thank you very much.
Thank you, Dr. Blackwood. Really appreciate it. So we want to go into the our actual Charla series. Our first speaker is Lázaro Herrera, who will share a personal perspective. Lázaro, the floor is yours. Our first speaker is Lázaro. The floor is yours. Okay, we'll see you, Lázaro. Go ahead. The floor is yours. Lázaro, if you can just please unmute yourself. Andres, if you can go ahead and unmute Lázaro, please. I'm sorry, we can't hear you. Andres, if you can go ahead and, you know what, Lázaro.
Okay, can you hear me now?
Yes, we can hear you now. Go right ahead. Thank you.
Can you guys hear me?
Yes, we can hear you. I'm sorry, you've unmuted yourself again. Okay, well, Lázaro, we'll get back to you just so we can keep this going. Elvis, are you ready for your presentation?
Yes, I can go.
Okay, we're gonna go with Elvis Cordova right now. Lázaro, we'll come back to you for number 2, okay? While we get the technical difficulties going. Thank you.
Good afternoon, everyone. Thank you very much, Tony and the HHF team for putting this together. It's really important. What I'm going to do, folks, is I'm going to give you a very top-level overview of some of the government action that has been going on, so you're aware of it. If you need more info, we can chat later. I'll give you some resources that you can go to find more information about this. But essentially, there's been 3 phases of relief that have been provided by the government. The first phase is essentially what was called the Corona Supplemental Relief Act, and that essentially was signed into law and put $8.3 billion of emergency funding designed to treat and prevent the spread of the COVID-19 virus. It essentially provided additional funding to the Health and Human Services to develop vaccines and testing kits for local communities, the state and local health departments to be used for staffing increases, and additional laboratory equipment to the federal government to aid in the international containment of the virus. Phase 2, which was recently signed about 2 days ago on the 18th, is called the Families First Coronavirus Response Act. And it was really a result of hard-fought negotiations between Speaker Pelosi and Treasury Secretary Mnuchin. Now, it's designed to really provide assistance to 3 particular areas: unemployment benefits, expanding food assistance, and providing paid sick leave. And what that's kind of comprised of is the package includes 2 weeks of qualified sick leave wages for those employees who must self-quarantine or seek treatment due to the virus. It establishes a federal emergency paid leave benefits program to provide benefits to employees who are taking unpaid sick leave due to the coronavirus outbreak, and expand unemployment benefits and providing grants to the state for processing payment claims. Hold on, I lost the video. Can you all see me? Okay, great. It's also requiring employers to provide paid sick leave to sick employees. Now, it's also providing employers tax benefits for paid sick leave and family paid medical leave, helping them offset some of those costs. And it also allowed USDA to be able to expand its food nutrition assistance programs. So that's, the SNAP program, the Supplemental Nutrition Program, and as well as the Women, Infants, and Children. It also allowed more funding for the Emergency Food Assistance Program. It allowed for nutrition assistance grants for U.S. territories, so that's Puerto Rico, the Virgin Islands, Guam, the Mariana Islands, and also provided nutrition programs that assist the elderly. And those funds are coming out of the Department of Health and Human Services. Now, this is important because it allows certain waivers to requirements for the school meal programs. So that's where you're seeing, although schools are closed, you're seeing the school meals programs continue in some municipalities and some states. It suspends work requirements for the SNAP program, which was formerly known as the food stamp program. And it allows states to request waivers to provide certain emergency SNAP benefits to vulnerable communities. Now, it also focuses on helping individuals, businesses expand their COVID-19 testing and helping those healthcare workers by providing requirements for coronavirus diagnostic testing at no cost to customers, treat personal respiratory protective devices, and countermeasures for eligible liability protections for some workers, and increasing Medicaid and federal medical assistance percentage, a percentage increase for particular states. Now, what's important about these particular benefits is they become activated when the states declare emergencies. Now, at last check, I believe up to 40 states or just under have declared emergency, have declared, local state emergencies. And so that activates these particular, the president did activate the national emergencies, but then the state governors had to then activate their particular states as, emergencies. And so by doing that, that activates access to these particular benefits. So all 50 states are expected to go into a state of emergency, which allows them to then go into these. And what you're seeing now is the beginning of phase 3. Now, those are being worked out between the administration and Congress. And that's that stimulus package that could go anywhere from 180 billion to 1.5 trillion. It's being negotiated. And what that's going to focus in on is relief for businesses, direct payments to individuals. A lot of you have been hearing about direct payments from the government. That's what's being worked on right now. It's also going to cut payroll taxes. So an idea of some of the things that they're discussing are relief for the airline industry. There's the small business relief packages, direct payments to Americans, the payroll tax cuts, flexible state and local aid from different block grant programs, education and child care benefits, as well as health, tax benefit programs, public transportation relief, senior citizen relief, housing, infrastructure, travel and hotel industries relief packages, restaurant industry packages. And so what you're seeing now is a lot of the chambers of commerce beginning to put together webinars such as this, which are targeting the small business owners, telling them about this, and also taking in some of their particular crisis areas, because what they're going to do is they're trying to get this to the legislators so that they can provide that type of relief in that next phase of relief that's being designed. So I know that was a lot. We're kind of on a truncated schedule here, so I wanted to give you a very top view. But I definitely encourage business owners to go to SBA.gov. Folks who are looking for the tax benefits and what the payments are going to be, go to Treasury.gov, because all of the different government websites are starting to provide that information right on their websites so that folks are aware of what's going on. And so I'll hang out if folks need any additional information, but I hope this is helpful in giving you that large overview of a lot of different moving pieces that are going on. So I think that's all my time. Thank you. Dario, we can't hear you.
Oh, thank you, Elvis. Lázaro, unfortunately, we are having trouble hearing you right now. We're going to go ahead and loop you back in to the presentation. Our next speaker, and we do want to continue with this presentation. Our next speaker is going to be Nancy Santiago Negron, who's going to be talking about Ureeka and small businesses. Nancy, the floor is yours.
Hi guys, can you hear me?
Yes, we can hear you. Thank you.
I'm going to ask you guys too, if you don't mind, if you can give me access to show a slide or two, but let me start with saying that I have COVID. So let me start by saying that I am quarantined. I am also asthmatic. And so I am in the extreme high risk category. I think it's something else to mention to you guys too, that there was another outbreak similar to this 10 years ago in 2009. And 10 years ago in 2009, when the H1N1 outbreak happened, we also didn't take that one seriously in the beginning. And in 2009, I lost my younger brother, who was 29 years old at the time, 29 years old, also asthmatic, contracted H1N1 in New York City during the Puerto Rican Day Parade, where we were all at together. And he was gone within the week. 29, he died 30 days shy of his 30th birthday. So for folks out there that are telling you that this isn't serious and there aren't high risk categories out there and you're not at risk because you're not older, please ignore all that and make sure you share with people my story. I am sitting at believe it or not, I'm sitting in my teenage bedroom, guys, because I was on coming in from Miami, stopped here to visit my family on my way home, and developed a fever here after my flight. So I have not been able to leave. And I am quite worried because I'm in my old teenage bedroom with my parents who are older and also at risk. So I have spent the last few days since, it's been 10 days now, guys, on a whole lot of medication, wearing a mask when I leave this room, wearing gloves, and trying to make sure that I not only stay healthy, but that I don't infect people around me, particularly my parents. So let's talk a little bit about what this is going to do for folks. So I needed to make sure folks know to be careful and to understand that if you don't think this is actually happening, it is. And here I am. And today I can talk, which is nice. And I think I'm out of danger. So I'm happy to see everyone and know that you guys are paying attention to this. I'm going to share with you guys a few pieces of information that I think are important to note. And you guys can actually see a lot of this information as I post it up on both Twitter and Instagram. You can easily find me on Twitter at Nancy S. Negron. Instagram, it's Nancy Santiago Negron. Let me share with you a little bit of something here, guys. The host is disabled the screen sharing. So whoever the host is, guys, if you let me, I will go ahead and share with you some slides. But I want you to understand that the spread is doubling, right? So it's spreading exponentially. As of yesterday, 2 days ago, we were at 5,000. Today, we're topping 13,000. So think about what that growth means for us, and think about what's happening in our biggest cities where we have the largest Latino communities. We are effectively shut down. The reason we're focusing on the economic side of this is because we know that this is going to be, it's going to have a hard impact on everyone. It's going to reset the economy probably in a more severe way than 2008 did. But I think that one of the things that folks need to recognize is that unlike 2008, some of us will recover quickly, but communities like ours will be devastated. And I think what I need folks to understand is the economic numbers that are playing out right now for us are quite scary. We, for the first time in a very, in I don't know how long, are going to have this week over 2.5 million applications for unemployment. To give you an idea, if I could show you that chart, and I'll send it to you, Dario, so that you guys can forward that chart. But if you do a little bit of a search right now, there's a new chart that was put out this morning that shows the number of unemployment claims that are going to be filed this week. When you look at that chart, the spike is so high up and it is so scary that the only thing that you see on that chart is that rise today. To give you an example of context, in 2008, where we had the greatest number of unemployment claims, that 2008 mark on this slide is not even noticeable. That's how much the spike that we're going to see this week changes things for people. What we've been focusing on right now is the economic impact on Black and Latino small businesses. Particularly those two communities will be the hardest hit. As you know, we have an extraordinarily high number of hourly workers. All of our hourly workers are out of jobs right now unless they're working in any of the essential services. We're looking at families who will lose very quickly their businesses and all of their savings. And so we need to understand what that's going to play out like in the next few months. At Ureeka, we've been doing webinars and we'll continue to do them to try to help prepare business owners as best we can. We had one last night and I'll make it available to everyone. But so that you have a sense of what's going on right now, we're telling people that they need to be paying attention to some very basic things. So if you know someone who's a small business owner, if you are one yourself, you need to be paying attention. First, we need to calm you down. Everybody's freaked out and that's a normal feeling. But what Dinah did for us in the beginning is really important. We all need to take a deep breath. And as anxiety generating as the situation is, we need you to focus on some clear things as a small business owner. You need to focus on cash, your accounts payable and your accounts receivable. You need to focus on contracts. What contracts do you have with which suppliers? What are you going to be held to? Even though they're creating all these kind of force majeure and opportunities for people to be protected in things like mortgage and bills, that's not going to last forever. What are you going to be responsible for? And finally, compensation. If you have people that work for you, if you have one other person that works for you, what is it that you need to live on? What do your employees need to live on? Those are the most important things to pay attention to. We have all kinds of information for you guys. We'll have it in English and we'll have it in Spanish. at some point, I will go ahead and send to the team over at the Hispanic Heritage Foundation both the charts and recordings of the webinars we've already done. We will continue to do them, and we have offering free coaching and mentoring to anybody who logs on to the platform who needs help right now. It's not just about money. Some of us have something saved and we can work with that, but when you don't know where to start to use your money, none of that matters. So for those of you who are losing money, for those of us who may have some squirreled away but don't know what to do, you're going to need some help. Don't be afraid to ask. Please come online. The services are free. We're here to help. You can log on to www.ureeka, spelled UREEKA.biz, and you can use the code to register. HHF Beta. That's Hispanic Heritage Foundation, HHF BETA. You have to be invited with a registration code to join, but please come online. Please ask questions. We've migrated a lot of nonprofits that support small business owners onto our platform. So folks are there looking to help and looking to make sure that we can help save our families' businesses, because the impact on our communities will be devastating. Thank you, guys.
Thank you so much, Nancy. Very, very informative, and we pray and hope that you feel better very, very soon. Our next speaker is going to be Veronica, who will be speaking about language access needs. Veronica, the floor is yours.
Phone versus the computer. Yes.
Yes, we can hear you. Go right ahead. Thank you.
Excellent, excellent. And you can go ahead and start the slides, guys. So one of the things I'm jumping on, I'm Dominican, I'm an entrepreneur, I'm a mom, and I'm really involved in the community. I'm speaking on behalf of all those roles I'm wearing. Just like you've heard previous presenters, we have a lot on our plate. And you can go to the next slide. I wanted to kind of center us a little bit to hear what we're hearing and what we're seeing. And then I'm going to give you two things I really want us to work on. Right now, our community is very fearful. And I want you to remember the Latino community, we represent over 20 countries, obviously, but the acculturation piece, everyone on the phone and everyone presenting is fully acculturated. We're Americanized. We understand the news. We get where we can get resources. We can Google. But there are a lot of Latinos that are on the lower end of that acculturation spectrum, que no entienden nada, que no saben nada, and they're afraid. So that's impacting their ability to comprehend information. We're also seeing a lot of price gouging. We're having folks that are being charged 2 and 3 and 10 times the price. Maryland is passing legislation, thanks to some incredible elected officials like Jocelyn Peña-Melnick, to protect our community, but our community doesn't know that this law is in place. We still have Latinos working. We have our front line, retail, low-skilled, hand, blue-collar workers working out on the street. They're not informed of people that may have had coronavirus in their space, and they continue to show up. They need to collect a paycheck. They're not being informed. Access to healthcare, we have folks that are confused. They don't understand if they can get tested, if they can walk in and get care. And then the alternate piece is if they do take advantage of all of these resources that are being shared, our community is thinking that it would be considered a public charge event. So again, major confusion. The last two pieces are being shared now. We're hearing people addressing food insecurity. Our elders are stuck at home. We have folks, the kids in particular, in lower income communities that do not have access to food because schools were closed. So we're mobilizing resources, but I want you to hear what's going on. This is what we're seeing in Maryland, and it is exacerbated if you're on the lower acculturation spectrum. Si no hablan el inglés bien, they're not connected. And if you go to the next slide, this is the challenge. This is the way we can solve it. And I'm going to ask everyone here to do this. If you do not have access to a translator, use us. Use whoever you have in your sphere. But you must translate vital information, absolutely your alerts, your information on washing your hands. Yes, the CDC is producing Spanish content, but not all of that applies to every industry and every factor and every segment, rather. So make sure that the information you're translated is culturally and linguistically appropriate. If you're dealing with a Salvadorian and a Dominican and a Nicaraguan and a Spaniard, it's different Spanish. So please be sensitive. And you can't tap a receptionist, you can't tap someone in your office, and because they speak Spanish, you're under the assumption that they speak sufficient Spanish or appropriate Spanish to communicate publicly. Make sure the information is accurate and it reflects the latest terminology being used by the CDC. I'll give you a quick example. We're so behind. We're getting requests today in my company to translate documents that are still referring to the 250-person ban. They haven't caught up to giving us a 10-person.
I think we lost you, Veronica. Not sure. Can you hear us? So sorry. We will, I am so sorry, but we're going to move on. And if there's time, we can loop back with you. Let's go with Juliana. Is Juliana on? Okay, Juliana, you're next, please. Feel free to, please go ahead and unmute your mic. Juliana Cardona Mejia will be speaking about leadership and small businesses. No, we cannot hear you. If you can please unmute your mic.
Can you hear me now?
Yes, we can hear you now. And then go ahead and unmute the video as well.
How do I do that?
Top right.
Got it.
Yep, perfect.
I think I got it.
If not, we can hear you, so no problem. You can go ahead and start. The floor is yours.
Sounds good. If you can send me a request to unmute the camera, I'm happy to do that. If not, I'm gonna go ahead and start. So many of the speakers have covered a lot of the facts. Mine is a call for leadership. I once heard that leadership is not something you are, it is something you do. And moments like these forge leaders. My name is Juliana Cardona, and I'm the founder of Street Entrepreneurs. We're 50% African American, 20% Latino, or serving organization. Over the past years, we have started 400 small businesses, and this year we will support 1,000. I am at the front lines. I'm here as a representative of small businesses, entrepreneurs, and social innovators alike. Many who are being impacted by the economic contraction of this crisis. Over the past few days, I have received calls from businesses and individuals who are struggling. Too many to mention, but I'll mention a few just to contextualize many of the facts the fellow speakers have shared. Maddie, a candle maker who just opened her brick and mortar at Union Station over the past couple months, hasn't seen foot traffic in weeks and is concerned about paying staff. Someone else called to say the lack of sales is jeopardizing their capacity to pay rent. And it's not just economic sickness, but both physical and mental issues or concerns. Social isolation can worsen clinical depression and grow the rates of suicides. Colleges have gone virtual, and students without a personal laptop won't be able to finish the semester. I'm worried about family members back home while the borders are in lockdown.
Juliana, I'm sorry, we can't hear you. Juliana?
Come on.
Okay, now we can hear you.
Can you hear me?
Yes, yes, please keep going.
Awesome. Did you hear the last part?
No, if you can just go back 10 seconds of where I think we lost you for about 5 seconds, 10 seconds.
So as I was mentioning, I'm at the front lines. I'm here as a representative of small business entrepreneurs and social innovators alike, many who have been impacted by the economic contraction of this crisis. Over the past few days, I have received calls from many individuals who are struggling. Maddie, a candle maker who just opened her brick and mortar in Union Station, hasn't seen foot traffic in weeks and is concerned about paying staff. Someone else called to say the lack of sales jeopardized her capacity to pay rent. And it's not just economic sickness, but both physical and mental issues are also concerns. Social isolation can worsen depression and grow suicide rates. Colleges have gone virtual and students without a personal laptop won't be able to finish the semester. I'm worried about family members back home while borders are on lockdown. I'm also thinking a lot about our incarcerated communities who are in detention centers. I could go on, but I won't. I just wanted to contextualize a little bit of the facts. I believe in this moment, there's three kinds of people. There's those who hide their heads in the sand and pretend nothing has happened. Then there are those that panic, go out and buy all the toilet paper and go into hiding. And finally, there are those who take the first mover advantage to act. Over the past few weeks, I have been all three, but I am convinced that we must strive to be the leaders that our world needs in this time, because leadership is not an option. So what can you do? Here are three simple things you can do. If you have a neighbor who is elderly or is sick, offer to do their groceries. If your work is low and you're at home watching Netflix, volunteer. If you don't know where to start, write me. Two of my team members are sick, and I desperately need people who know PR and Salesforce to mobilize small business owners in Washington, D.C. If you're bilingual, volunteer at a hospital. You can do this over the phone. You translate. Finally, Street Entrepreneurs is launching a fund to help small businesses minimize layoffs while state and federal aid kicks in. And if you are a small business owner, I want to hear from you, especially if you're in DC. We have a survey. We want to know what you need. Is it people? Is it crisis? Is it training? Is it money? Is it knowing how to better target your money? What will help you get through this? That's what we want to know. So thank you very much for listening, and if I can be of help to anyone, please reach out.
Thank you, Juliana. Really appreciate it. That was great. Our next speaker is going to be Susana Sandoval. Susana will be speaking on coalition building and local economies. Susana, if you are on, the floor is yours.
Can you hear me?
Yes, we can hear you perfectly.
Okay, great. I'm actually want to do a video. I wasn't going to, but I'm going to try to see if it does. Can you see me?
Yes, I can see you.
Okay, great. Gracias and bienvenidos a todos. Thank you for having me on. I'm not going to go into putting any details. I think most of us are pretty attached to our phones and our communities right now. I just want to reiterate that during this time, it is a time for reflecting on what our individual gifts are. We all have to do a self-assessment of what's necessary for us and for our own individual families. And we need to do something that it's an exercise that I've done over the years in the nonprofit sector and doing board development and in any other leadership situation that I've been in, is we need to do an assessment of what we have within our networks. And I think that this is a great opportunity for us to look at who is in this charla, who is within the HHF familia, our networks, and seeing what systems we have knowledge of. I might sound like an economist. Having the subject of talking about local economies and looking at what our economies of scale are. I mean, first is knowing what resources we actually have and knowing how to allocate them. I currently serve as a United Nations Human Rights Commissioner, and we have been dealing with it at a global level, seeing it pretty much on a daily basis. My frontline changes day to day. My schedule is changing day to day, and I'm managing my own self-care, that of two young adult children who are millennials, and also my mother in her late 70s. And so as a caretaker and someone who's in and out of different systems, it behooves us to know, to do an assessment for ourselves of what our necessities are, what our current local communities' needs are, and how we can contribute to that local economy. I think one of the biggest things that we can do is to remain calm. I constantly tell people that I will be the ultimate optimist, but I'm also at this point, and because of the level of information that I have at my disposal, it's alarming to see how people are managing, and it's also reassuring to see that our communities are coming together and that we are pulling our resources together. I have an association chamber workforce development background. I have pretty much been a generalist rather than a specialist. And I'm grateful for that during these times, because I have been able to advocate from a industry perspective in general opportunities and one-on-one conversations. I will be glad to engage offline in another moment if HHF wants to coordinate, or I'm plugged into a lot of different networks that have been doing national organizing calls. But I do want to say that there are resources out there. One of the biggest concerns as a small business owner myself is that there is relief to workers for any kind of disruption. And I say workers first and foremost, and also to small businesses, which are the backbone of this community. And I also in closing, because I'm looking at my time, right? Want to encourage us to reach out and to really press forward on the current leadership that we have, both in governmental institutions and the folks that are supposed to be looking out for our interests at all levels. And it behooves you to use your voice. And what I will share with you, with one of the elders told me today, we were chatting about leaders that we have met in our lifetime. And she said, at this point, I'm going to be, I'm in my late 70s, and I've been able to meet so many different people. And we have the opportunity to reflect and spend time with ourselves and to document our stories. So it's a great time for you to be chatting with our families, with our familias, and our elders about the history that we are living and the history that we are making. Gracias.
Thank you so much, Susana. Really appreciate your thoughts. Our next speaker is going to be Mr. Carlos Zavala, who will be speaking on education and impact. Carlos, the floor is yours.
Hello, everyone. Thank you so much. So definitely going to be aware of my time. So today what I wanted to discuss is pretty much how COVID-19 here is pretty much opening an eye to the disparities that we're seeing across the country when it comes to the Latino and Black communities, specifically when it comes to education. What we are about to analyze is going to be an impact that truly we don't know how bad it's going to affect kids from pre-K all the way to now going into college. And even going into the workforce. Right now, the Department of Education released the newest study showing that our graduation rate is at 85.3%. However, for the Black community, that is at 79. For the Latino community, it's 81. But we all know that those communities tend to live in more socioeconomic, like low socioeconomic communities. So that's even less, so you go into the 79 again, and then those with limited English proficiency are all the way down to 68%. So this is right now with the tools available at schools. And what we're seeing with schools being shut down across the country is we're forcing parents here, parents who probably don't know English, parents who don't know how to use technology, being that teacher and have to help engage their children into subject matter that they truly depend on schools to do. And what we're also going to see the impact is going to be in communities where we don't have access to technology, right? Because this is the biggest thing that we're talking about at the moment is, perfect, it's fine. Our students are moving to online classrooms. Our teachers are prepared to teach, you know, or they have the tools or resources available to teach online. But however, for our communities, especially those that do not have the economic resources to have a personal laptop, access to internet, access to good enough internet, because I mean, let's be honest, Zoom takes a lot of Wi-Fi speed. And then as well as, I think the biggest one that was talked about earlier is the access to translated materials. As of today, it takes time for schools, almost a week, to translate all of their messaging that they have around this virus to parents that don't speak English. So what we're hearing is it's pretty much parents who are overwhelmed, and what we're going to see is a drastic impact in the education of the Latino and and Black communities. And the other thing, definitely worth it's. These are all things food for thought as we will start seeing solutions pop up in the next couple of months as to how to really address this even more. But I mean, this situation really just helped highlight how unprepared our country is to help our communities and provide the resources necessary to be successful. Specifically when it comes to childcare, for pretty much when the Latino community, we are your janitors, we are your cooks, we are everyone that is still considered essential personnel. We are the people working at grocery stores. We are the people that, yes, we still have to go to work. Our kids are now here at home. Who's going to watch them? So it's thinking about the impact this is having right now will have for years to come. But that's pretty much what I wanted to do. And, for food for thought, if there's ever anybody you can help, teach them a new tech skill, that's pretty much, there's a various amount of resources available. I'm very happy to send those out for pre-K through 12, as well as for higher ed institutions on resources that they have, either whether it be teaching platforms, specific courses like sneaker design, things that can keep students engaged. And there are also programs that are available in both languages. So definitely reach out. Happy to share those resources out. Thank you.
Thank you so much, Carlos. Really appreciate that informative presentation. Our next presenter is Jesus Nebot, who's going to be sharing his personal perspective. Jesus, are you on? And again, just want to remind everyone that if you have questions for panelists, we will have some time for Q&A at the end. Please utilize the Zoom webinar chat to type in your question with your name, as well as who that question is directed to. Our next speaker, Jesus, the floor is yours. Thank you.
Thank you. I don't know if you guys can hear me or see me at this point.
Yes, we can see you and we can hear you perfectly. Thank you.
All right, sounds great. Well, first of all, thank you for this opportunity. I think there is much need for all of us to share in community and help each other. We've had wonderful people already speaking. Juliana, Cardona, as a matter of fact, shared a lot of things that I was going to share, so I don't need to share those.
You should be asked to execute.
I did love the presentation from Nancy Santiago Negron, giving us a real reality check, because the personal perspective that I want to bring myself right now is the one of perhaps one that a lot of people have had already. It's a lot of frustration with the lack of proper leadership to address this crisis in a timely manner. And for the last month, it's been very difficult for me. I'm originally from Spain. I have friends in Spain and in Italy, and I've been seeing how this is unfolding. And it is personal for me at many levels, because first of all, my sister that also has a precondition is at this moment sick and quarantined in Spain. And so it's her husband and her daughter and a couple of close friends. I also have a friend that is a neighbor in Madrid, Spain, that is at the UCI, and he's very sick. He's 50 years old. He's not that old, and he didn't have any preconditions. So it is true that we don't have all the information and that this is very serious and affects a lot of people. And one of the things that I've been doing is checking the coronavirus resource center at the Johns Hopkins University. and some of the information that is available to all of us right now is really is concerning. And I don't think we're getting it, because we have heard that the death rate is 2%. But I mean, if we look at the data today, we can see that that death rate has risen to 4.1% globally.
Okay, we can hear you now. I'm sorry, continue.
Okay, so now I was talking about, I don't know where I lost you for a moment, but the fact that I do have family in Spain and friends in Italy, and I've been obviously following the news from them and realizing how this country is poorly prepared. We have heard so many things from the president. Of course, this is the best prepared country, but reality speaking, as we know, in China, they built a hospital in 10 days, and it's taking us 10 freaking weeks to have a test that can be widely available for everyone. So what I was sharing is some of the statistics that we now know that we're confronting, which is that the death rate in the world right now has risen to 4.2%. It is obviously different in different countries. In Iran, it's 7.3%. In Spain right now, it's 5.1%. Spain has just become, after China and Italy, the third country with most cases. And in Italy, the death rate, and I don't know if many people know this, I haven't seen it in the news, the death rate right now in Italy is 8.6%. And the reason for that is not because, you know, necessarily people have to die out of this, is because their system has collapsed. And of course, my concern is that this is what is coming to this country based on the graphics that we're seeing, you know, in probably 3 weeks. So we need to be aware that unfortunately we don't have leadership that we can really rely on at the White House, and therefore we need to emphasize this type of communications between communities to help each other as much as possible. For me, I have limited time. What I'd like to share is that I think we need to think globally. I think that this crisis is giving us the opportunity to realize that this concept about nations and separations and borders and walls is absolutely obsolete. It does not help anybody, and it does not stop crisis. And of course, what I miss right now is real global leadership. What I miss right now is to obviously have a president that can unite all presidents and meet and find good common sense solutions, because we all need to emphasize the need of this social distancing everywhere in the world. It's not just in the US, it's not just in California, it's everywhere. And I think that is missing. But I want to share that, for example, one of the groups that I am active with is AVAAZ, which is AVAAZ.org. And right now we're all pushing to do this, to sign this petition for the G20 countries that are going to meet in a short amount of time to really focus on some solutions, specifically on cooperate to develop a vaccine and treatment for all, launch a green recovery, adopt social distancing now, but in all countries, suspend rent and mortgage payments in parts of the world where don't have maybe the assistance that maybe we can get in some other countries, and wrap up the production of vital supplies urgently, especially in the US right now, which is protective equipment for medical staff, ventilators for the very sick, and et cetera, that we know that right now is the next thing that we have to focus on. But with all this said, I also want to leave this in a very positive note that, listen, things are changing, and this is going to take maybe a couple of years, but this is an opportunity for us to go within and meditate and you know, and realize our interconnectedness and be grateful that perhaps this virus is awakening us all to the realization that we are all one, and that we all need to come to that understanding and work together and collaborate and not point fingers and blame others, but really cooperate and use our common wisdom to find good common sense solutions. As a community, I would say that there is a need for us to focus on the undocumented, make sure that the undocumented can have also some service and some assistance in this time. And for those that are documented, that they are not afraid of public charge, that they can still access assistance without the fear that they're not going to become citizens later on. And for those people that are in jail, I also think that we need to ask for them to be released, especially those
Absolutely.
that...
Absolutely.
So, all right, I know I don't have time.
Thank you, Jesus. I don't want to cut you off, but I do want to be respectful of everyone's time.
Thank you.
Thank you so much. We really appreciate it. With that being said, our next speaker is Robert Sterling, who is an undocumented and uninsured individual in our community. Robert, the floor is yours.
Hi, everybody. Can everybody hear me?
Yes, everybody can hear you perfectly.
Awesome.
Thank you.
Awesome. Okay. I'm unmuting my video. I'm not sure if everybody can see me.
Yes, we can see you. We can see you, and we can also hear you as well, Robert. Thank you.
Okay, awesome. Thank you. Thank you for the introduction. Thank you, guys. How's work from home for everybody? How's Zoom? So I wanted to thank Tony and the team. Thank you to Dario. Thank you to everybody for putting this together, and a big thanks to our previous and our upcoming speakers. So I'm under the impression that this is an informal, somewhat informal charla, and as such, I apologize for rambling or a bit of nerves here and there. I am a DACA recipient. I am a DACA recipient, and I want to approach things from that perspective, and my own personal perspective. And you know, I'm young, I'm healthy. As such, I'm blessed. My sister is not so lucky. She's asthmatic. My parents are older and not in good health. So COVID-19, this pandemic, this virus, is something that ever since conditions began to deteriorate across the Pacific, you know, there are multiple layers that this is. There are multiple layers in which this is impacting us as a community. The fact of the matter is, we're in a bit of a crisis right now. We're facing an economic crisis. We're facing a public health crisis. We're facing an ongoing humanitarian crisis with border detention camps and the people held there. We are facing a humanitarian crisis with our incarcerated community, who is at risk of being disproportionately impacted by the virus and by this pandemic, and by our utterly inadequate healthcare system, and that is something that also worries me. But aside from overly worrying and platitudes, I do believe that now is the time for us to step up as a community and to lead our communities across the country. So 3 things that I've identified as being most important is one is to inform our communities. I believe we need accurate, to-date, factual information disseminated to our communities, within our communities. We need to find a way to be able to take accurate, up-to-date info, not something from 2 weeks ago when we were still learning about the evolution of this outbreak. And we need to be able to contextualize that risk in a way that makes this threat relevant to our communities. We need to be able to prevent, as a second pillar, be able to successfully communicate and enable MPIs or non-pharmaceutical interventions, such as social distancing, staying at home, which oftentimes is particularly difficult for people who rely on schools, which in some places are now closed for childcare, who depend on being able to, on work to be able to pay the bills, and who oftentimes find themselves forced to actually go out when they're told to stay in. We need to be able to prevent and be able to, or protect and be able to guide our community members, undocumented community members, in order to for them to seek adequate medical care. And we need, as such, we need to get a better grasp on how test kits are being distributed, which providers the testing is being done throughout, what the state of reagent availability is, lab capacity, and we need to be able to engage with community health centers, local community-based organizations, patient advocates, and patient navigators in order to help these people, our communities. So I would actually want to ask for help. I'm going to wrap this up real quick. I want to ask for help from everybody who is currently listening or tuned in order to be able to sort of put together some sort of orchestrated effort in order to be able to facilitate that access for our undocumented community. And I'll go ahead and follow up with everybody after this chat. So I'm probably out of time by now, but thank you guys.
Thank you, Robert. Really appreciate it. That was very, very informative, and we really appreciate you for sharing your story. Our next guest, we have a few presentations left before we open it up for Q&A. Our next guest is Allison Kokkoros, who will be speaking on resources and professional perspective. Allison, the floor is yours.
There we go. Am I unmuted now?
Yes, you are unmuted and we can see you.
Okay, great. Thank you, Dario. Thank you, team, Antonio and team. You know, this is hard being separated from each other. You know, I'm with the Carlos Rosario School here in Washington, D.C., and this has been my life's work, and really a blessing to go into one of our 2 buildings every single day and see our students and see our teachers and interact with my colleagues. And it's just really hard not to be there with them every day, because that really is a community for all of us. So we've gotten really good at Zoom really quickly. And I was glad to see that that's what you were using for this charla today. And so I did want to just share what we're learning, what we're working on, which relates to some of the concerns and observations that fellow panelists brought up on this call so far. Just to start out, just at 3 p.m. today, our Mayor Muriel Bowser announced that they are going to continue and extend the shutdown in DC, including the closure of schools, DC schools, through April 27th. And so it's a tremendous, huge impact for the community that we serve. At the Carlos Rosario School, we are serving 2,000 students who are all adults, immigrants to this country, mostly Latino, but really from all around the world. It's like a mini United Nations. And if you talk to any one of our students, they will describe our school to you as their home and as a family. And so this is a real interruption for them, and not only in access to work, but access to that sort of link to information and a sense of community at our school. So what are we doing so far? You know, I'll share with you, but we're learning from all of you, our peer organizations. We're really leaning into communication and have been doing that all along. We have a number of channels that work for our students and their families. I was just checking it out. We have over 9,000 people following us on Facebook, and they really engage with us on Facebook. We're also on other platforms, but that seems to be the one that where we have the most folks following us and engaging with the school. So we're pushing out information on Facebook about what is COVID, you know, education and information, on hand washing, you know, safety, CDC connections, and we're doing it in multiple languages, in English, in Spanish, in Amharic, and in French, looking at the immigrant groups that we have here in DC. So a lot of communication, not only on social media, but also emails that we're pushing to our students, as well as person-to-person communication with teachers to our students and our counselors to the students. And as of this coming Tuesday, we're going to be doing something that's unprecedented as a school, and that is distance learning, remote learning. And as an adult education school, just like some of you were describing earlier, we're working with community members, many of whom have very limited access to technology. Some have laptops. Our school has issued laptops to as many as we could. Many have smartphones, and so we're trying to innovate and adapt very quickly in leveraging the technology that people actually do use and are used to using daily. So our teachers have gotten really creative and are going to be using QR codes that our students scan to get the daily lesson to work on their phone at home. And so this is going to be, we're embarking starting this Tuesday in a real experiment. And we're having a team meeting on Monday, all hands team meeting, to brainstorm how we could continue doing this through the remainder of the school year, because we realize it's a very real possibility. And so we're going to have a lot of learnings over this time, and we're going to be really glad to share with you what it is that we're learning. We have a number of technology resources that we've employed already that our students have told us are working really well for them. So I'd be happy to share that. We've compiled some of those. And so that's just what I wanted to share now, sort of an idea of how we're innovating, how we're trying to solve some of these problems that the folks on this call have been talking about, especially when our role in the community is as this trusted space, as a home and as a community for our students. We continue to have, I feel like now more than ever, this role and responsibility of connecting our students and keeping them connected to each other and to us as a school, and making sure that they get good information and supports.
Absolutely. Thank you so much, Allison. Really appreciate your perspective and obviously your leadership in the educational space as well. Our next speaker is Alex Martinez, who will be speaking to us about digital organizing. Alex, the floor is yours.
Sure, can you hear me?
Yes, we can hear you and we can see you.
Perfect. As it was mentioned, I'm Alex Martinez. I'm a poet organizer living in Kansas City, Missouri. I organize in Kansas as well. First off, I want to recognize all the privilege that I have by sitting here and talking to all of you. Because there's a lot of people, specifically, I'm going to talk to my own experience. A lot of people in my family who have lost their jobs, who do not have any more income, who have no idea what they're going to do. My family is really small. There's seven adults and 6 children between all of us, and only 3 of us have an income for now. So we don't know what's going to happen after this. So we are concerned about the future, and so there's a lot of uncertainty about a lot of issues that affect me personally. I'm also a DACA recipient. I'm worried about DACA. I'm worried about public charge and the misconceptions of people that are not educated on it. I'm worried about also people not participating in the census. So I think it's a lot of the things that are happening, with what's going on with the virus right now. I think there are some great opportunities to push and to demand from our government to do the right thing, and it's unfortunate that it takes a virus to do a lot of the things that are happening. But some of the things that have been happening here in Kansas City is we have obviously been working remotely and pushing our mayor and other elected officials to do the right thing. As I mentioned just before that comment, the Supreme Court might have a DACA decision soon. They're not hearing any new arguments, but they are issuing decisions from arguments they already heard. And a lot of people are concerned because, as we know, the makeup of the Supreme Court, it's not looking great. But it is the time to demand the extension of DACA recipients. As of today, USCIS is not processing renewals. So it's the time for us to go to get on our Facebook, especially if you work for an organization that does advocacy, or even if you don't, it's the time to demand that DACA recipients permits are extended for 2 years. There's a lot of advocacy organizations already demanding that, and so also a lot of us are losing our jobs, and if we have DACA, and there's a lot of worry about the public charge rule affecting us in the future. Currently, DACA recipients do not qualify for green cards, so we have to let people know that they can apply for unemployment. So that is really important. Also, USCIS issued a statement saying if someone does apply for a green card in the future, they can send an affidavit explaining why they receive benefits and specifically naming the virus. So that is some of the organizing work that we're doing. One of the other things that I wanted to briefly mention is the census. They are obviously postponing or slowing down their field work, but a lot of the people can self-report, and we're encouraging everyone to fill out the survey online. It is, some of us are privileged enough to just be chilling at home. So we can film ourselves doing the census, telling our community why is it important to do it. People can go to my2020census.gov, and it's available in all the languages. And I think it's important for us to do this digital organizing now, to advocate for people who, to do it in multiple language, like it was said earlier, to make sure that people are counted, to make sure that people are represented. And also, if you have a DACA recipient or any undocumented folks in your family or that you know of, check on them, please. Give them a call, a text. I know it's hard to like not see someone face to face, but just check on them. Our mental health right now, it's hurting. So so it's important for us to stick together and to just keep organizing and keep pushing. And like I said earlier, it's a great moment to. It's not a great moment. It's an opportunity. This moment to push for more. Thank you.
Absolutely. Thank you, Alex. Really appreciate your time and your insight. And finally, our last speaker of the evening before we open it up for Q&A is Nury Castillo Crawford, who will be sharing her personal story regarding the coronavirus. Nury, the floor is yours.
Hi, and really my personal story, guys, really quick, is I am a lifelong educator. I am a first-generation immigrant. I came when I was 10 years old. And I've been a teacher, a school principal, and currently work at the district level at the 14th largest school district in the state of Georgia, Gwinnett County Public Schools. And I launched a Hispanic mentoring program. And what everybody has been sharing in regards to the lack of equity for our children, and not all of our children, because nothing is absolute, but I will want to say that the majority of our children either do not have a computer or have one at home, but they have to share it, and there's a lack of access to be able to complete the work assigned digitally. In addition to that, because I have the mentoring program, I've been able to connect with families one-on-one, because we have monthly events where I've gotten a chance to meet with the parents and meet with the mentors and meet with the kids. And so parents not only tell me that they don't have a computer or they don't have access to online, they don't have basic school supplies because everything was so interrupted so abruptly. And so they didn't have time to get those things together. In addition, a lot of our parents, whether they are proficient in English or not yet, some of them, the curricula is still new to them and they don't know how to support their kids. So some of those things definitely are becoming obstacles. I was literally on a call earlier today, and I wanted just to share some things that we're doing that to me are still not, equitable, but maybe might be helpful. One of the things is we're launching a volunteer tutoring via the phone. And so kids are going to be able to call in. We're doing a sign up genius per grade level and per content area. And the kids are going to be able to call in and say, hey, I have this question for reading comprehension, read the passage, help me find the answers or whatever. And so we're going to try to help kids walk through this and see if we can help. And I have gotten a lot of positive response to that. Another way, which is not equitable, is to give the kids printed out versions. And since a lot of school systems, including my own, deliver lunches and have lunches at the school, is to have some printed versions of the work already to hand out to the kids so they can at least work on something. Because my number one fear, and somebody else noted it as well, is that we already have a graduation gap that's, to me, in crisis. And so all of this is going to do is add more and increase that graduation gap for our kids. And I just feel like we need to try to advocate for them, and nothing else is really going to matter unless our youth are successful and we can invest in them as our number one priority, which they are to me. And so I just want to encourage everyone to, even if you don't have children, to see if there is a way that we can support our youth so that they can, still find hope and still graduate from high school, so that we can see those graduation rates go up and then help them move on to the next level of their journey in education.
Absolutely. Thank you so much, Nury. We really appreciate you listening in and providing your insights for this, for our charla.
Thank you.
With that being said, we are a few minutes, we do have a few minutes to take one or two questions, because we do want to be respectful of everyone's time. We did have a stop at 5:30. If you do have to jump off, please go ahead and do so, but know that we will follow up via email as we look to continue these very, very important charlas, discussions, within our community. Again, sometime next week, potentially next Friday as well, around this same time. With that being said, I know we have one question from Enrique Rodriguez for Allison. Enrique, if you're still on, can you please ask your question? Okay, I don't know. Does anyone have a question? Actually, we have one question here that I'm looking on right now. It's for Nancy Negron. Nancy, I know Catalina had asked you a question on, what inspires you to give back and serve your community, even in the face of unimaginable loss, thanks to the outbreaks like this, and what you need to do to learn more and to emulate that behavior. If you can just share your answer for the entire group, because I think that's a very important question.
Yeah, and I think I answered it to online as well, but I think for me, it's really about we have to take care of each other. And I used the example of Hurricane Maria. What I think the Puerto Rican community learned really quickly is that we don't have anyone we can really depend on, right? This is not a climate where as Latinos, we feel particularly safe. We feel particularly cared for. Honestly, it's the opposite. Latinos, quite honestly, are being hunted. And so we learned the hard way after Hurricane Maria that nobody was coming to rescue us. Not the government, not Congress, no one. We survived as a people and as an island because of the care and the attention of our own. And I think that that's a very important lesson we bring into what we do now. What inspires me are those moments of when all odds are against us, we don't die, right? We're like, Tony will appreciate this, we're like the good Mexican boxers, man. You knock us down and we keep coming back up, but we keep coming back up and we stand up again because we help each other. And I think that more than any time in my lifetime, I see the need for the community to step up and take care of each other, and for us to be thinking a little more strategically. This isn't just about taking care of this situation. The reason I'm paying so much attention to the economic side of this is, yeah, this part is hard, right? It's really, really hard. But what's coming may be even worse if we don't start to prepare and take care of one another. So what inspires me is the strength of my people and the fact that we keep getting back up. What propels me to do this work is a sense of social justice that comes from an activist mother. But what keeps me going in this, even when I'm feeling sick and doing breathing treatments 5 times a day, is you guys. The fact that we're doing this on a Friday night at 5:30 in the afternoon. It matters. So thank you.
Absolutely. Thank you, Nancy. And Nury, we have a question for you since we have you online right now. One of our someone has asked, are you accepting applications for online tutors and mentors?
Yes, so I have a call after this at 7. So we're gonna be creating all of the links, etc. So I'd love for anyone that wants to connect with me on social media. I'm under Nury Castillo Crawford, N-U-R-Y, Nury Castillo Crawford, and we're going to be pushing out the link on how to do all this tutoring for our kids. And we're not gonna, just have it only for our school district. Any child that needs help will be able to call and help and get some support.
Fantastic. Thank you, Nury. The next question is for if anyone wants to jump in. It's regarding mental health. Are there any hotlines, resources out there for people who are experiencing mental health issues during the coronavirus? And if so, where can we direct them to?
I'll answer. Can you hear me?
Yes, go ahead.
Okay. Well, they're still running the same mental hotlines, domestic violence one, the veteran ones. I can get a list there, that way
that would be great
for everybody. But those hotlines, and I really, there's a national suicide hotline. I think all those hotlines are still running. They're figuring out how to keep them running remotely for folks. And I believe that there was a group of people specifically. I think some of the states, I know our state has a COVID health something or other hotline as well. So I would imagine that some of the similar states are going to be doing the same thing just as well.
Fantastic. Thank you so much. Really appreciate it. The next question relates to younger folks who happen to have older adult parents or grandparents who live with them. What are obviously not going out and self-distancing and things of that nature, but what are other things that these individuals can do so that they to ensure that they're not passing on the virus to individuals that may have low immune systems? If anyone wants to jump in and answer that question, feel free to do so. Okay. I guess I will answer it. I think just be very careful. Obviously, you want to be respectful of everyone's space, but you also want to ensure that you are not putting yourself in spaces greater than 10 people, 15 people, and that you are practicing good hygiene, whether it's wearing gloves, whether it's sanitizing, whether it's definitely washing your hands, as Dr. Blackwood had mentioned, and a couple of others as well. I think that's very, very important. We'll take one more question. If anyone, we'll take one more question just very quickly. And I think Nury, this question is for you. This will be the last question. What your advice to parents that now have to stay in for the next 2-3 months, essentially homeschooling their kids, potentially longer, and how do they look to try to create a balance with homeschooling kids and also obviously being responsible for working day to day, whether it's at home or if they have to go into their jobs?
Yeah, so we've been instructed not to have more than 10 people in a group of contact, but I guess the only solution, because I think it's hard and I don't think there's a right answer to it, I would say that you need to try to find una vecina, una comadre, somebody that you guys could kind of like piggyback off each other and support each other. Definitely be in touch with your school system. Title I federal programs mandates that the information that you receive should be in a language that you prefer. So one of the things that we need to work on, and I sincerely try to work on year long, day after day, is helping empower our parents to know their rights and know what they need to ask for and demand from the school systems that they pay taxes into. So definitely help encouraging parents to get in touch with their school system. If the teacher doesn't want to help, not saying that they won't, but I'm just saying if they don't, then contact the principal, and then principals have bosses too. So just go up the chain if you have to, but you deserve to get support and you deserve to get it in a language that you understand.
Absolutely. Thank you, Nury. And with that, we will conclude today's charla on the coronavirus and its effects on our community. Thank you all. We really appreciate your time. Please be on the lookout for an email from our Hispanic Heritage Foundation as we will continue these conversations next week and moving forward, because they are very, very important, not only to us and our community, but to communities at large. With that being said, please be safe, enjoy your weekends, and please be mindful of others as we go and when we take this virus and this new chapter this next week moving forward. Thank you. Have a great weekend. And everyone, please be safe.